Chair of the International Trade Union Confederation Women's Committee, and Secretary Treasurer of the Canadian Labour Congress, and I will be moderating today's conversation. I'd like to begin today by acknowledging that I am currently speaking to you from the traditional territories of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and this land has been inhabited by Indigenous peoples from the beginning. We're grateful for the opportunity to meet here, and we thank all the generations of people who have been stewards of this land for thousands of years. We are all treaty people. Many of us have come as settlers, newcomers in this generation or generations past. Let me also acknowledge those who came here involuntarily through the transatlantic slave trade. I honor and pay tribute to the ancestors of African origin and descent. Again, thank you all for joining us today on the Global Day of Action for Care. First, let's deal with some housekeeping issues. This webinar is being recorded, and we will be sharing it on our Facebook page a little bit later if you want to watch it again or if you want to share it with your networks. We're also offering simultaneous translation in English, French, and Spanish. You should see a globe icon at the bottom of your screen, and you can click on your preferred language. Then please select the mute original audio so that you can hear the translation better. Let me also remind everyone that this is a respectful space, therefore we ask that you be mindful of this. And you can use the Q&A at the bottom of your screen, as well as the chat to make comments or ask questions. Now, let's see who is here with us today. We have a number of panelists joining us. You've already met me. We have Professor Sue Himmelwaite, who is coming to us today, I believe from the UK. Sue is the founding co-chair or founding chair of the UK Women's Budget Group, and she's co-authored two very significant reports. One with the Women's Budget Group called A Care-Led Recovery from Coronavirus, and the other one for the International Trade Union Confederation on investing in the care economy, which is exactly what we're going to be talking about today. Next, we were supposed to have Aya from UJTT Tunisia. However, she's unable to join us today, but I know that she wanted to be here with us in spirit. We also have, if we could get that slide back, Monica. Monica Valish is joining us today from Cut, Chile. She is a technician in early childhood education. She's been a leader in both the community and the union for over 25 years, and she is a member of AGUNJI. We also have Deborah John Yusufu, who's joining us today from Nigeria. Deborah is a critical care nurse. She is obviously on the front lines of the pandemic. She's also the state chair, for the National Association of Nigerian Nurses and Midwives. And last but not least, we have Editha, who is the statewide president of the domestic workers or the home workers in, I believe it's California. So I want to welcome all of our panelists this morning, or this afternoon or this evening, depending on what part of the world that you are currently joining us from. I also want to just thank very, very quickly the staff that are assisting behind the scenes. Thank you all. They will be monitoring the Q&A and the comments, and we'll get to them as soon as you write them, and I'm encouraging folks to just please comment in the Q&A or the chat group. Okay, we also, one last thank you, the interpreters. As I said before, we are coming to you in a number of languages, so I want to thank the interpreters. So let's get started. Let's get everything started. First question. And I'm going to ask that everyone give an answer, and we will go in different orders for different questions. So the first question is, the pandemic has truly reminded everyone of the immense value of the work that you do every day. Can you describe for us what it has been like to be on the front lines of this unprecedented pandemic? What has been of most concern to you while you've been on the front lines, and what have you found to be the most heartening and inspiring? So challenging and inspiring. Let's start with Deborah.
Thank you so much, and welcome to Action Day. As a frontline health worker and a critical care nurse in Nigeria and a stakeholder in case management team of the COVID-19 in Nigeria, I came face to face with the reality of neglect of our health facilities, with resultant effect of inability to rapidly respond to the emerging public health emergency in a developing country. The pandemic equally exposed the decay in the facilities and inability to effectively respond with minimal infection and adherence to health and safety measures of serious concern. Being at the Isolation and Treatment Center, it gives me joy, job satisfaction, and value as a nurse who puts her life on the line to save others. I'm equally glad to offer myself to serve in the Emergency Operation Committee set up to coordinate, to trace, and treat the treatment of COVID-19 cases in FCT Abuja. It has been a very mind-blowing experience, but it added so much value to my profession as a caregiver who is ready to serve, and also to render effective and efficient services in line with standard best practices. It also reminded me the risks involved in the management and care of infectious diseases and the need to take precautionary measures to stay safe. It equally brought out the importance and added value to the nursing profession in Nigeria, because people now see us as a profession in Nigeria that has to reckon with and as major stakeholders. Worthy of mention is the WHO's declaration of 2020 as Year of Nurse and Midwife. What a great coincidence. Being at the front line of this pandemic, firstly, was the fear of the unknown, especially with the deadly increase of healthcare workers getting infected, and equally, some of them lost their lives in the course of carrying out their duties. It was quite alarming, but with the passion and commitment to save life, we remain resolute. And also, we have to appreciate calls and prayers from our immediate family members and friends. During the peak of the pandemic, I see myself as a hero, as a gallant soldier who went to war and came back alive after tested negative 6 times consecutively during the course of carrying out this responsibility. There are some major concerns actually in Nigeria. Some are due to underfunding. The healthcare delivery system is truly underfunded, which make it difficult for most administrators to attend to the overwhelming emergencies. More support came from highly spirited individuals, organizations, etc. With adequate and sufficient funds, some of the challenges could have been surmounted. Inadequate laboratories for testing, that is molecular laboratories with basic rapid kit testing, there are very few in Nigeria. And infrastructures too, we have challenges towards that end, because health facilities to be used as isolation, holding, and treatment centers are lacking in Nigeria as of that time. And most importantly, infectious disease hospitals for treatment of such cases are inadequate, and also inadequate functional equipment. To be honest, even the personal protective equipment, some of our workers are exposed to working without provision of PPEs, that is the personal protective equipment, which made their life to be endangered and made them to be vulnerable to the COVID-19. Ventilators too were lacking, cardiac monitors were lacking, infrared thermometers were lacking, even the basic consumables were lacking. Talk about the manpower development. We have great shortage of manpower of healthcare workers in Nigeria that is even below the WHO standard. The laboratory scientists for testing are very few. The public health nurses, even the community health workers are equally very few, those that can be engaged in tracing and also treating. Then the healthcare workers were surely overwhelmed. The doctors and nurses were fewer. They were stressed up. They suffered burnout during the peak of the pandemic in trying to offer their best to contain the virus. So the need for training and retraining is very, very important in order to cope down the healthcare emergencies, and then the training of occupational health and safety cannot be overemphasized. When it comes to the issue of personnel also, the health insurance policy has not been put in place. So many workers, healthcare workers, have endangered their lives. Some died in the course of carrying out their lawful duties, and they are not being compensated up to this moment. Hazard allowance too were not being paid, despite the hazard that the healthcare workers were exposed to. Stigmatization, this is very, very important because so many at times, the healthcare workers suffer stigmatization from their environs and even from their immediate communities and even from their families. In fact, some of them will have to settle disputes between husband and wife because the husband will be like, don't go to any isolation center because you are going to be infected and you are bringing back the virus home. So we suffer a lot of victimization around us. And lack of basic health education on the part of the public too. I believe with so much education, the stigmatization couldn't have arose in the first place. And I believe with adequate sensitization and mobilization of the community, it could have been surmounted. And we have a futuristic plan for immediate action. That is, had it been there's a strengthening of the public health, that is education, through provision of communication equipment, etc., etc. We have to have a strategic plan for future outbreak, response through establishment of the initiative, especially the disease control hospitals, infrastructural upgrade, provision of operational measures too. And enlightenment for the community and grassroots involvement is very, very important. The prompt response, what is a bit inspiring is the prompt response by the federal government in trying to contain the spread of the diseases is highly commendable, which has equally resulted in low death rate in Nigeria. And I have to tell the government that investing in care is a wise investment. The right way to achieve universal health coverage is very, very important. And I want to say a shout out to all the healthcare workers as we celebrate this day. Thank you.
Thank you, Deborah. And in my haste to get to the questions, I didn't do my introduction, but I want to finish off with question one first, and then I'll go back and talk about why it is we're doing this today and why it's so important. So let me go to Monica, and then Editha will come directly to you.
Hola, hola, buenas tardes. ¿Me escuchan?
Good afternoon. Can you hear me? Can you hear me? The sound is very low. We can hear Monica, but the sound is very low. So the pandemic has been a very difficult moment physically. It's physically difficult when we are working, and there were many problems also at the level of our interactions with our families. When discussing the well-being of my community, we raised some questions such as what was the most difficult thing in this specific context. And in fact, it is the fact that we cannot hear the kids running, singing, or hear the noise of music. So it is a problem that there is less interaction on a daily basis between adults and kids, or to find a place where we can meet all together. We work many hours every day, so we have very short breaks. We cannot not always meet together to have lunch and to discuss and to laugh together. While that is very important, these emotions are very important at work. And it's also very difficult when we have contacts with the kids. It was not possible at all times to give all we wanted to those kids, and we could not continue educating the kids. So there was a lack of interaction with all of them. While this is very important because families have problems to be connected, there is also a percentage of people coming from other countries living in very precarious situations without light, without water. So there was a very high concern concerning the kids who do not have what they should receive, and all the means that were available were not enough. Now, it is also true that education of a child is also something that is based on emotions. There is an interaction, for instance, with the babies. That's very important if you want to generate sensitivity. And we've also had some problems with the parents because it was difficult to organize the visits when a baby was to come, or to organize the visits of the little brothers or sisters who wanted to see the baby. All that has been very difficult. And it was very difficult also to realize for us that we worked many, many hours to try the best we could. Then we have also the use of ICTs in the houses that could help us, but many people do not have the equipment, do not have the opportunity to be trained in order to use those technologies. And there were very difficult situations in the households because the children, the mother, the father, they all have to work using the internet connection, and they do not have all the tools in order to be able to do that all together at the same time. Then we also have the problem of the quality of the internet connection, and remote work is therefore difficult. Houses have to be transformed in a place of work. That's very difficult. And there was a very high percentage of people who had problems. Once the pandemic is over, we hope that we'll find solutions to all these problems, because we do not want our households to become workplaces. And sometimes there was also a decrease of salaries, of wages for people, 30% or more. And I think that we'll have to be very careful and follow the evolution of the situation after the pandemics, and we'll have to see what happens with the different protocols that we will have to implement. In the region where I live, it's very, very hot, and to work with a mask on your face for many hours followed is something very difficult, very hard, and it can also lead to some problems, health problems that are not very well known. So I think that we'll have to study the different protocols very carefully, and we have to make sure that the people working in the educational sector and the children have a good communication system. But I think that many things are going to be forbidden, like a gesture to show that you like the kids. The little children, they need that. They need to be touched. But most of the time, it's impossible. And all this is part of the life you have as a teacher with the children. It's part of the game. And even when you play with them, we cannot get close to them. But kids need to play. They need a special kind of attention. They're going to rush into the arms of the people looking after them, for instance, and they cannot do that. And Entonces, I think that we'll have to very carefully analyze the situation and see what's going to happen in the future. For sure, it's going to be difficult, but I think that it will also be rewarding when we will be in a situation where it will be possible to go really back to work in real life and support the population. But before we are able to do that, I think that we will have to discuss with the families about about the rules, about the protocols to be established. We have to educate families concerning their health. And children, in fact, are the ones who will be going to school, and the mothers will have to know how they can work with us. They have to know how we're going to work on a daily basis. Thank you very much for listening to me. Thank you. I give the floor back to you.
Thank you so much, Monica. There is so much in that. Things definitely change with us all working from home. I'll comment on what you had to say after Editha speaks. Editha, we're heading to you.
Okay. Hello, everyone. My union, UDW, United Domestic Workers, represent over 120,000 workers who provide home-based care to low-income seniors and people with disabilities in California. So we work for a state program called In-Home Support Services, or IHSS. I care for my daughter, and like of all my fellow union members who care for a family member, and I know I'm giving a better care than she could get anywhere. The personal care services we provide allows our clients to live at home in comfort and dignity. IHSS home care workers keep hundreds of thousands of Californians out of the institution that allows them to participate in their communities. When the pandemic hit, Gavin Newsom, the governor of California, declared IHSS providers essential workers. Of course, that's exactly what we are. But we soon found out that labeling us essential workers was just that, a label, just words. At first, we had to scramble to get ourselves PPE, the protective gear like masks, gloves, and sanitation supplies. It seems so scary. Most of the worst impact of the pandemic were happening at the nursing homes. We were taking care of very people who would be in those nursing homes if it weren't for us. Yet we are on our own to protect them and ourselves from infections, because our union, UDW, jumped into an action and pressure the state. We were able to get access to more PPE as the pandemic has gone on, but we are still treated differently than other essential workers. Other frontline workers got financial help like housing or other forms of support. Meanwhile, home care workers were left on our own handle to handle new responsibilities and problems. We responded by the following CDC guidelines: wearing masks, even at home, protect ourselves, our clients, and our families. We had to increase the time we spend cleaning, set aside extra time to run errands during the early hours, and everything. Groceries, pharmacy, doctor's appointments got complicated and took more time and energy. It is very stressful in so many ways. And I'm sorry, a lot of those clients staying from daycare have developmental and cognitive disabilities. The change in the routines upsets and agitates them, and their caregivers have to deal with some very challenging behaviors. For home care workers, our union has always provided a form of social support, but we were going months without in-person meetings or direct contact with our fellow members, and it has been very heartbreaking to lose members and their clients during the pandemic without being able to say goodbye. What has been inspiring to me is the strength I have seen from my membership. We have found new ways to communicate and connect. A lot of us aren't great with technology, but we have become expert on Zoom and other tools and help us to do what we need to do. Caregivers are the strongest people I know. This pandemic has shown that to be true time and time again. Thank you.
Thank you, Editha. And I'm glad that you talked about your daughter, because, you know, during this pandemic, many of us, majority women, had those extra responsibilities while still trying to work from home. And so it definitely spoke to all of the things that we have been talking about for decades as union and community women. We know that many of the countries were ill prepared to deal with the scale of this pandemic. And again, the millions of care workers that were out there, care and health workers, overwhelmingly women, overwhelmingly racialized, and being on the front lines, overwhelmingly negatively impacted by the impacts of COVID. Suffered more death, more illnesses, and that's not just in one country, that is everywhere. So the reason that we are having this webinar is to talk about the impacts of COVID-19, but even before COVID-19, how the world of work, how our society treats women and deals with the things that impact us in a negative way with Band-Aid solutions, rather than looking at a holistic way to deal truly with women's economic justice. We put little Band-Aids on these particular issues, which never actually deals with the situation. And COVID-19 actually not just exacerbated the situation, but also shone the light on the situation that we're all facing right now. So we want to have a conversation. So I want to also encourage those of you who are listening today, those of you who are participating, to, if you can't get a question out, just share your stories as well, because I don't want you to think that you are the only one out there that's dealing with these issues. We're all dealing with them now, and we need to be working together to figure out how we push back, what needs to be put in place for a proper post-COVID recovery. And we've been talking about not a recovery, but a she-covery. And we can't, in Canada, we say we can't have a she-covery without childcare. Well, you can't have a she-covery without care services, period, right? And there's no recovery without a she-covery. So with that, let me go to question 2, and that goes to Sue. So Sue, you are with the authors, one of the authors of Creating a Caring Economy, A Call to Action. Could you describe the work of the Commission of a Gender Equal Economy and walk us through the key findings and recommendations of that report? What is the Commissioner's vision for a caring and gender equal economy?
Well, it's fantastic to be here. Thank you very much for inviting me. I thought you were going to, when you started by asking people's personal experience, I thought you were going to come to me and I was going to have to say, well, I'm really sorry, I'm not a care worker, I'm not a frontline worker. But actually, I have felt a bit like a frontline worker over the past few months, because I think this is a fantastic opportunity for those of us who are care activists, and I think that's exactly the same thing as being a gender equality activist. To seize the time, because now seems to me an extraordinarily good time to make some of the cases that we've been making about how important care is to gender equality. Chidi, can we have the next slide, please? What we've seen from the pandemic is a clear indication that something wrong, that the economic system isn't working. And it's not working particularly for women. I have to say, I don't think it's working for a lot of people. And what we've seen in most countries is entrenched inequality. It's become much more obvious as it's clear that those people who are suffering have always been the victims of inequality and now also more the victims of the pandemic. A general neglect of well-being and the economy. Could we just go back again, Chedu, one more? But all this has come from an overwhelming focus on short-term financial interests. And this has impacted in the ways that we've just heard, particularly on women, through increased unpaid work, a lot of job losses that are particularly women have experienced, increased work pressures, and more likely to be in those occupations that are exposed to the pandemic. Now, next one, please. But we've also seen some really good, hopeful things, that we've seen enormous outpourings of care and kindness coming to the fore. In my street, there's been so many sort of care networks set up. We've had to divide our email group into three pieces in quite a short street. We've seen that key workers have kept us going, and the vast majority of key workers in most countries are women. That we've seen that government intervention is possible and powerful, that crises don't impact on everyone equally, and above all, that we are the economy. We make and sustain the economy. And so this is a good moment for saying, what kind of world do we want to create, and what sort of economy do we want? So, 2 years ago, nearly 2 years ago, we set up in the UK a commission on a gender equal economy. I'm a member of a group, the Women's Budget Group, that spends a lot of time criticising various government policies, either proposed or actual ones, for a lack of concentration on the gender impact of those policies, that they may be good policies in some respects, but they're not paying attention to gender equality. So we set up a commission to look at what would a more gender equal economy look like. And one of the things that I think is interesting, talking now to an international audience, is of course that we recognise that not everything could be done at national level, and that a lot of the things might be common to other countries, but they could only be solved by intergovernmental action. So what we're talking about is pressure not only within one's own country, but making demands on international organizations too, like the ITUC. All right. So what was our vision? Our vision was that in order to have gender equality, we needed a caring economy. And what we meant by a caring economy was one that was a sort of intersection of one that looked at gender equality, that focused on well-being rather than phony economic measures, or not phony economic measures, but the ones that economists tend to focus on, and on sustainability. It had to be something that had to be able to be kept going, not environmentally, but also in terms of people's lives. It ought to be reproduced. And we considered 8 steps to that. First of all was that we had to change our view of what was meant by the economy, that we didn't, the terms cost, efficiency, productivity had to be redefined so that they measured more than just market value. The second thing was we needed to invest in social and physical infrastructure. I'll say a bit more on that a bit later, but in particular on those services, care services, that are just as important to the underpinnings of an economy as the bridges and roads that are often talked about as infrastructure. We needed to transform the worlds of paid and unpaid work, to change the boundaries between the two and make movement between the two much easier. We needed to have social security systems that were based on dignity and autonomy, and to ensure that no one had to choose between feeding their family and their own life chances. We needed to reform tax systems to make them fairer and more redistributive. And we needed a complete change in fiscal and monetary policy to focus on building a caring economy, rather than adopting short-term targets, for example, for deficit reduction. Instead, we needed to make long-term investments in creating a caring economy. And we needed to work so that we'd have an international trade system that is socially and environmentally sustainable. So ensure that international trade and competition doesn't undermine labour and environmental standards. So something like the ITUC is absolutely vital in pushing for something like that. And overall, work to transform the international economic system, support the establishment of intergovernmental bodies to promote transparency, and in particular, to eliminate global tax evasion and avoidance that hits everybody hard, but hits poor women particularly hard. And for this, we said we needed a care-led recovery. So this was building on the work that Marie said that we had done originally, commissioned by the I2UC, on what would happen if you did invest in the care economy. What sort of jobs would be created? And we out of that, we proposed investing in paid services very specifically now to lead a recovery from COVID-19. And that would do that by improving well-being through meeting people's care needs, creating more employment than the sort of employment that's generally talked about as a stimulus out of a recession is investing in construction. We said, let's consider investing in care rather as well as investing in construction. And of course, it would be employment that improves gender equality. So this is some analysis we've done quite recently, more recently than the original reports you looked at now. I've focused on the some European countries. This is probably true for a lot of richer countries. Poorer countries, first of all, we often don't have the data, but secondly, the notion of a care sector is not as clearly defined. I think it would be, you would find similar results, but you have more difficulty in defining exactly what you meant by a care sector, because so much more care is unpaid in poorer countries. So if we just look at European countries for the moment, and for each country here, you see, we've looked at what would happen if you invested 2% of GDP, either in construction or in care. And we looked at all the jobs that would be created, not just the ones that would be created directly in those industries, but the ones that would be indirectly created through the industries that supplied the care or the construction industry, and what's called induced employment, the employment that will be generated by the spending of those extra workers employed. And you can see that in every country, the total number of jobs created by investing in care is far more than the number of jobs created by investing the same amount of money in construction. And we've also coloured those jobs according to whether they are for men and for women. I didn't want to use traditional colours, so the women are in red and the men are in green. And you can see again that one of the big advantages of investing in care is you get far more jobs for women. But actually, if you just look at the green line, the line of green jobs, you can see that you can produce a very large number of jobs for men too by investing in care, almost as many as you get by investing in construction. Can I go on one next slide, please? So what we would argue is that to have a care-led recovery, to have government investment in care would improve well-being through meeting people's care needs. It would stimulate employment through a creation program that improves gender equality, not make it worse, as investment in construction would do. And here I've got the figures for the UK because that's where I come from. But in the UK, investing in the care sector creates 2.7 times as many jobs in the economy overall as an equivalent investment in construction. 6.3 times as many jobs for women, and actually even slightly more for men than investing in construction. And this is because of the induced jobs. A lot of whom would go to men. And when we did the original study, people said to us, well, you're just talking about producing poor quality jobs for women. So we looked at, well, what would happen if actually you paid those care workers properly? So we looked at what would happen if we paid them the same relative wage as they get in Denmark, which is the best country we could look at for a standard. And you would still get twice as many jobs through investing in care as you would get from investing in construction. And finally, investing in care is sustainable because a care job produces only 1/3 of the greenhouse gas emissions of a construction job. And of course, an economy with more people employed in care is a lower emissions economy, because a care job produces less than the average type of job in economies now. So what we would mean by a caring economy, therefore, among other things, is that it would have a larger proportion of its workforce employed in care. Okay, that's basically it. If you want to look further at any of those things, the links are here. And this is the day to get all this started.
Thank you so much, Sue. I want to encourage folks to actually take a look at.
Muchísimas gracias, Sue.
Sorry, I'm hearing the Spanish interpretation in my ear. Everybody can take a look at Sue's work, and I'm going to ask, if possible, our staff in the background, if they could put the link up so that folks can can copy the link, so they'll be able to read the document. And I think that there was a question there too to see whether or not it was available. It's only available in English, Sue?
I'm afraid so, unless the ITUC has done the original reports in other languages. I don't think so.
Okay, and so if it's available in other languages, for sure that we will make sure that we get it out to folks. And so we've already talked about what the pandemic has done, but one thing I want to say before we get to the next question is that it has underlined the centrality of health and care to our well-being and existence. If we don't have that, we're not well. And the need for adequate investments in equitable, quality public health and care systems is more apparent and urgent now, as been laid out again, and the light shone on by the pandemic. So let me just go back to the other panelists and ask this question. So if you had a magic wand, what is the one change that you'd like to see happen right now, and why? And I'm going to start with Editha.
All right, thank you again. Like everyone, I would like to see a vaccine come out right now and stop the pandemic. I don't want one more person to be lost from this disease. And I want us all to be able to do the things we love and to see the people we love again. But more specifically to my members and our lives, I would like to see long-term care and healthcare become a right for everyone. Our program is always in danger of cuts. In May this year, California was facing a projected of $54 billion budget deficit. So the governor, Gavin Newsom, proposed cutting IHSS care hours by 7%. Our clients are assessed their hours based on how much care they need to live safely at home. They go through a whole process with a social worker who visits the home and makes the assessment based solely on need. They need every hour they assess. For the state to cut 7% of their care is inhumane. We organized our members, fought back and won. Our clients' hours weren't cut, but we are tired doing this. We are tired of our program being the first thing to be cut every time the state has problems with the budget. We need to start seeing long-term care as a basic human right. With my magic wand, I will move long-term care up the list of everyone's priorities. We will be the first thing to be funded and the last thing to be cut. If we did that, we could raise the pay for home care workers, so more people will want to do the work and there will be enough care for everyone. And home care workers and the families could live longer, healthier lives ourselves. Thank you so much.
So a living wage with benefits, proper benefits and pay, and proper personal protective equipment, number one. Yep. Okay, thank you, Editha. Moving to Monica, same question.
Bueno, también es muy importante con respecto a lo que...
Well, for me, it is very important to be able to live from now on with the perspective of a vaccine. That's the most important thing, I think, so that, well, vaccination is the most important thing so that people can have the feeling they can live freely again and to live with the families, to live with the friends, and be able to live again in such a context that we feel energized, where we can have an exchange with people in all fields. And of course, the most important thing is also the work that should be correctly remunerated. It should give a good remuneration to everyone, and we need to have changes that are the necessary steps to improve the situation of the families, of the children, and of the parents. We have to value our future, and we have to do that by identifying better development perspectives, and we have to value life and work, and we have to strive in order to improve the life of people. We have to also make sure that there is non-gender-based primary education. Education of children should be something unique so that all the kids in the country can have the same access to education. In the past, in the 70s, when I started working, education was education for all. It was an equal system of education, but later on, new institutional policies were implemented and the government changed some things. They said that it was necessary to focus on children considered as being a priority. But I think that children all have to be considered as a priority, and they all have to be equal, and they have to have an interaction with the others, even if they come from different backgrounds. And for instance, if you have a child with a special needs, well, that child should be able to have an interaction, a relationship with the other children. And based on equality, you cannot make a difference. All the children have to have access to the education, and we do not have to have any cultural differences anymore. And as human beings, we have to ensure that there is this equally based education for all. And we need an equality world, a happy world, and it must be the case for all the women at work as well as at home. Women have to be heard by other women. They have to get to know other realities. And I would like to say hi to everyone, particularly to Maria. Thank you for listening to me. I think that it is really great for me to have had the opportunity to represent women from Chile. Thank you.
Thank you so much, Monica. And you did mention, Editha also mentioned that the vaccine was one of her #1 as well. And we know that things can't really get back to normal until there is something. But I just want to caution that we need to make sure that that vaccine has been tested and all the scientific research has been done on it before it comes out. I can say that as you know, as a Black woman, we've heard the stories and tales, and we know people who have had vaccines tested on them. We don't need to go back to that. So we want to make sure that all of the scientific research is done prior to having a vaccine and ensuring that everyone takes it. Thank you, both Monica and Editha. Deborah, we're back to you with the question with respect to your magic wand. What is the one thing you want to change right now, and why?
Yeah, thank you. My magic wand is to see how this pandemic will come to an end, so that we'll be able to go back to our normal way of life, our social gatherings, going to church, going to market, not going about with the facial masks. That is one of my magic wand. And also, I want our members who have been in the isolation centers to be able to return to their families, because they've been there for so many months. Some of them have suffered psychological stress. I want them to go back to unite with their families. And equally, I also want them to go back to resume their normal activities in the facilities, that is rendering services to other populace. And another magic one is to pay their hazard allowances, because most of them have not been able to get their hazard allowances despite being exposed to the pandemic. And compensation for those that have lost their lives. We have so many of the healthcare workers who lost their lives and they're yet to be compensated. So if I'm the one, I would rather pay for their compensation, and also to introduce a policy, health insurance policy for the healthcare workers, which is very, very important. And also, if I had the capacity, I would like all healthcare workers to have an upgrade of their salaries because of their hard work. The government should be able to reward hard work. And also on the issue of the vaccine, yeah, before the vaccine come on board, as you have rightly said, I prefer the vaccine to undergo some scientific tests before it can be given to anyone, to any volunteer, and let it be on a voluntary basis. Whoever wants the vaccine can be given the vaccine, not to be a policy. And the issue of victimization is still on with the healthcare workers. I would like a free society that there will not be victimization for any healthcare worker, especially those that are working in the infectious disease hospital. And lastly, too, and most importantly, the infrastructures in all the hospitals should be up to date, because most of the equipment are obsolete. Let the hospitals be equipped so as to prevent future occurrence of the pandemic, and thereby have a healthier society and then a healthy nation. Thank you.
Thank you, Deborah. So yes, we definitely need healthcare workers and care providers to be paid properly, and for governments to make that investment in the care economy. But we also need to ensure that the unpaid work and the unpaid care work that we do is recognized, either that it's paid or the distribution changes so that more men are also doing part of that work. So there are a number of things that we definitely need to ensure happens for things to actually, I don't want to say get back to normal, because I don't know if I want to go back to how things were. I want to go to set a new normal. Let's look at what people were able to get when this pandemic hit in particular countries. Some countries found money for pandemic pay, they found money for protective equipment, they found money for all kinds of things, 24-hour childcare in some countries. If they can find the money on a dime for that, they can surely find the money to pay the people who ended up being the essential workers, the workers who ensured that we all could live during this pandemic. Surely enough, they can find the money to pay those workers what they actually deserve. And again, if they were able to find the funds at that time to create pandemic pay, then we know what those jobs are actually worth and what they're willing to pay the jobs. And you know, there's a lot that I could say about this, but I really want to open up to the audience and open up to those who have questions. And I recognize that I have questions that are coming up in all kinds of languages. So let me just skip down for a second. One of the questions that has been posted in the Q&A, and anyone can answer this, is, don't you think a strong campaign is necessary over time for the ILO Domestic Workers Convention 189 to be ratified in order to guarantee minimum conditions for this group of workers? And I would add to that, I was going to talk about it at the end, I would add Convention 190 as well, because Convention 190, you look at the convention and the recommendations, there are guidelines in there that people have used, governments have used, workers have used, employers have used to deal with the situation of the pandemic. So the question is posed, don't we think a strong campaign is necessary over time for the ILO Domestic Workers Convention 189 to be ratified in order to guarantee minimum conditions for this group of workers? And I'm going to go to Editha for this particular question, as this is stuff that she does on a regular basis working with home workers.
Yes, of course. Well, just to let you know that in California, my union, UDW, as I mentioned about, we've been cut, in different ways, right? They cut the clients, hours of care. However, it's affect our workers. I have 120,000 workers throughout the state of California, 21 counties. What we do so far, yes, we did a very strong campaigns. We rally, we make calls, right? We reach out to community allies, our community groups, right? So even though your family, your neighbors, right, need to get involved, we constantly going up to Sacramento office, to lobby. We have a group of lobbying coming up in there. We bring our clients. Even though our clients is on the wheelchair, you're in a cane, or wherever possible we can. We mobilize thousands of workers. And not only that, we hit the statewide and we need the local levels too, because it's 21 counties. We have a board of supervisor, elected leaders who are friendly to us, or even though it's not friendly to us, then we want to make that, build the relationship to become friendly to us. If no one knows about the home care, what we do important in the state of California, then we need to educate each and every one of them. How important being a home care worker, how we can save money here in California, rather than getting the institution, we save a lot of money because we pay less, right? So I think one thing is I really advise with each and every one of us, when we fight, we win. We are not going to give up in anything that we know this is our rights, this is our rights to have the wages and they should deserve us. Then we should fight in the end until we got to win. So I agree that I think the ILO, and I'm familiar because I have a family all over the world, right? From Japan, Australia, Philippines, Indonesia, Singapore, and most of my family members are frontliners. And I understand the ILO on how it works. Not only being a frontliners, we also have hotel workers, we have also housekeeping, we have nannies, we have everybody there, doing the job, but it's still, we're always below wages. They did not recognize us. The way on how they recognize us is to pay us on a livable wages, right? And give us the benefits, and we deserve that. I think we need to fight, and I'm with you guys. If you need me, let me know.
Thanks.
I'll be there for you to support you.
Thanks, Editha. Let me get to some more questions that are in the chat, and this relates to the question that I just spoke to, and it's from Bruno. I'm not sure where you're from, Bruno, but welcome. And he says, though I agree it would be good to invest in more care, isn't it more about getting paid for the current unpaid care? Women and girls put in 12.5 billion hours of unpaid care work each and every day, a contribution to the global economy of at least $10.8 trillion US a year, more than 3 times the size of the global tech industry. Any comments on that? I realize that the question has been answered, but any comments on what Bruno had to say? Sue?
I would say that the two go hand in hand. That one of the reasons that care workers are so badly paid, a sort of underlying reason, is some sort of notion that women should be doing this for nothing anyway. And so supporting, recognizing the amount of unpaid care that is going on is absolutely vital in order to raise the status of care and to show that actually, whether it's paid or unpaid, our economy runs on it. And I think it is undoubtedly true that, you know, whatever utopia we have in mind, it won't be one that completely excludes the notion of doing some caring for each other for nothing. That we won't want to turn it entirely into a paid care industry. But what we want is that nobody has to do unpaid care in ways that undermine their other life chances, and nobody has to do it unwillingly. Producing those conditions might depend very much on what goes on in the paid care industry, so that those alternatives are there. And so I really don't think it's an either or. And I think that we have to work on both simultaneously. Very important to do so.
Thank you, Sue. Is there anybody else that wants to add to that particular question before we head to the next? Monica, Deborah, nobody? Okay, so let me call on Maria to answer one of the questions on the Q&A live.
Hi, Marie.
Hi, Maria. I know that we answered that question already. There's a question in Spanish.
It's not a question, it's something that has been shared by Ana Soto from Venezuela. And Ana Soto is saying that indeed the pandemic has had as an impact to create unemployment and to create a lot of damage, and that we need to ensure that we see the problem within a different way. And of course, we need to ensure more humanity and sensibility in order to we change the world, and we need to increase the way that we value the world that we're living in and to our future. So just a comment from Anna.
Thank you. I do have another question. So this question is for Susan. Hold on one second. Trying to do 3 screens at the same time. And this one, Sue, is from Samantha. She says, thank you for your research and powerful findings. I'm curious whether you have shared them with any government representatives in the UK or elsewhere. And if so, what were their responses? Is there a plan to mainstream findings to trade union members of ITUC to advocate with their governments?
Well, we have, I don't think our current government is all that interested in it, but we have had some success with the Labour Party, who is the main opposition party in the UK, who has talked about investing in care as one of the ways out of the pandemic. So I think that, if you like, their hearts are with us, but whether, one of the things I find when I talk about these sort of things to bodies is that they often, I've given some presentations, for example, to groups of parliamentarians, and at the end of it, first of all, they're quite surprised. They haven't thought about care as a way of generating jobs. And so they're usually quite responsive and they're usually quite pleased. But then the next thing they write, you find they've forgotten about it. And I think this invisibility of care is infecting the invisibility of care research too. So I think we have to keep plugging it all the time. But I'd be very interested to know, since the ITUC has been also doing this for some time, what response they've had.
That's a really good question. So I know that there are folks in the background that may be able to answer that, so I'm going to ask Chidi Maria Marique, if you want to answer, you can say no and we can answer later, but if you have the answer for that, that would be great.
Hi, Marie. We're happy to come back to that towards the end.
Chidi's coming.
Just to give people a chance.
I can't hear. We can't hear Chidi.
Yeah. Sorry, I was saying be happy to come back to that at the end, just to give others a chance to speak. But thank you, Sue. Thanks for passing that on to us. That's great.
Bear with me, folks. I'm just going through the Q&As as well as the chats to make sure that I haven't missed somebody's question or comment, keeping in mind there are a lot of comments that are in Spanish. Let me ask, Maria, are there any comments there in Spanish that would be helpful to the panelists with respect to comments that they can make, thing that I can't understand?
No worries. I can read just a few comments that I think are interesting, and I can read them in Spanish so you all have the interpretation.
That would be perfect.
So there is a comment from Gerardo Altamirano who says, sugiero a partir de esta conferencia.
I suggest that from this conference, global single register of carers may be created in order to identify the quality of service.
And maybe also to share two questions that were shared before by two Spanish-speaking participants. So one question was, ¿cuál será el nuevo costo para nuestro género?
Which will be the cost for our gender?
And another question also posted in Spanish was, ¿qué pasará con esta nueva forma de...
What will happen with this new way of interacting in our working spaces and with our families?
I heard the second question. The first question was a little bit low. I'm not sure if any of the panelists heard. They didn't. Maria, do you want to come back with the first question? The second was talking about the new situation that we're in, and what is it? How are people managing in this new situation, and what will happen going forward? And I would ask, what would happen going forward if this state of what we're in continues, or if things change? Is there anyone that would like to take on that question? Actually, Monica or Deborah, either one of you that want to talk about what this new reality is like and what will happen if this continues in your own fields? Can we unmute? Monica, did you want to comment?
Okay. Yeah, can I comment?
Deborah, Monica's going to comment first and then we'll come to you. Monica, you're back on mute. Okay, Deborah, go ahead.
All right, yeah, thank you so much. Yeah, if this thing continues, we look at it as a new normal. Already we've been adjusting to it, but it's going to have an adverse effect on our members because it's going to overstretch the healthcare delivery system because we have a shortage of manpower, and the same nurses and other healthcare workers that are working in the isolation centers, they are the same also working in other facilities. So if this thing continues, it seems that the health workers will be overwhelmed, and then they'll be burned out and they'll be stressed. So I hope that it will not continue let there be an end. And also the government should be able to employ new nurses and midwives and hygienists and other healthcare providers so that to be able to contain and also live up to expectation. Thank you.
Thank you, Deborah. Sorry, Monica, go ahead.
Bueno, yo también pienso de que hoy día sería importante que...
Well, I think that the states have to be responsible for the situation of workers, male and women, in order to hope for recovery. So I think that many people have worked a lot during this pandemic, and I think that the state has to recognize the work done by these workers, male and female.
Thank you, Monica. We have another question posted, and that I think was the first one that Maria talked about and we didn't quite hear. What will be the new cost for women? You know, with all of this, what will it mean for us going forward? And just, you can put your hand up and I'll just ask for you to be unmuted if you want to respond to that particular question. So we started talking about that earlier. If things continue the way that they are, and we're now in a second wave of this pandemic where things are being shut down again, you know, we don't know what's going to happen with schools, with childcare, et cetera. What does that mean for women? What does that mean for women in your part of the world? What does that mean for women that you represent? What does that mean for women in your particular community? Editha?
Okay. So first of all, just to let you know, most of home care workers are women of color. And we deal with this every single day. However, the care that we do for the client right now is more longer care than before, because, you know, what we do so far is, you know, I think we got to face the truth that we need to open up our own home to become a child care program, daycare program, right? So we got to deal with it until, I know we're not going to back to normal. Probably we're going to get back to the normal, you know, in a different way. However, so it's gonna, women is strong. We are so strong. And most women are love to do the caregiving. So I think what I say that to everyone is just, you know, since that we're dealing with it, I think we can deal with it until we come to the end that, you know, is going back to a different normal way. So all we gotta do is, I think, as women, you know, we can unite each other and let's us, you know, share our own concerns and everything. That way we can make it, you know, like better, you know, feelings for each and every one of us, because we need a lot of moral support. We need a lot of resources, you know, to make this happen, because even though we're women, we need a lot of help, you know, to make this happen every single day that we're doing, you know, serving our community, taking care of someone, you know, making it making a difference in the life of people that we serve.
Okay, Edith, I'm going to let some others jump in because I see Sue's hand, and I also want to make a comment about one of the things that you had to say. So Sue, go ahead, because I don't think the issue is that women aren't strong. We know that we're strong. The issue is we are doing work that we're not paid for, that's not recognized, and that needs to happen. Sue, what do you have to say about that? Still muted.
So sorry. I think in a number of parts of the world, I mean, I'm thinking particularly of countries with the sort of that have developed aspects of the welfare states. that a lot of that has enabled quite a bit of women's equality, that it's through the development of public services and so on that women have been enabled to go out to work. But in a lot of countries, that has also depended on a huge structure of private industry as well. So, for example, in my country, childcare is largely a private sector industry. And these industries are going to do badly. Both care homes and childcare provision is going to, the vagaries of the market are going to mean that some will survive, some won't, and it's women who will be picking up the pieces. And I think that this is a really strong reason why we need public intervention in this. That market processes take a long time to build up; they don't necessarily work to the benefit of all. We have to use the recognition that has come of the importance of care through the pandemic to argue for a more secure, sustainable care system. And I think that's possible to do. I mean, I think it's certainly possible to make the argument. Whether people will listen is a different point. But we shouldn't be backward in coming forward to make that argument.
Precisely. Thank you, Sue. A comment from Nazira. I think that multinationals should contribute to the development of the vaccine, but there needs to be specific legislation to regulate them. That regulation is so important, Nazira. If that regulation is not in place, I would be hesitant to just take a vaccine that was produced without the regulatory bodies that are involved. But that's a good push that multinationals take some investment. A lot of them don't pay their fair share to support public services anyway. So, let them foot the bill for that particular one. Another comment, let me go to a comment and then I go to another question. As a citizen from the Gulf states benefiting from free and decent healthcare, my magic is both IMF and World Bank don't push our countries to privatize this very essential sector. This will be a nightmare for us. 100%. I'm not sure who made that comment, but 100%. That's not the way we want to go, for sure. I have a question that was posted by Zahada. She's from Algeria, and she'd like to know how concretely can a concrete persuasion for their government to invest in care. What is something that they can take to their government to say, hey, this is why you need to invest, this is what you need to invest? Deborah, do you want to?
Yeah, thank you, Marie. Yeah, from the question from the Algerian lady, thank you for that observation. Yeah, the takeoff one for your government, I think, is to let them know that investing in care is a very good investment and is investing for the future, especially the ravaging COVID-19 that is still ravaging the whole world. If they invest in healthcare, that kind of emergency could have been contained. And what they are going to invest in, one, is infrastructure. That is, they have to have more facilities. Secondly, they should also have an infectious disease hospital, which should be earmarked for treatment of infectious diseases, which COVID-19 is part of them, Ebola, etc., are all part of it. Even though we are not happy, we will not be happy to have it again, but level of preparedness matters. And also, they should also invest in manpower development. All the healthcare workers should be trained and retrained consistently so as to meet up with the global challenges. And also they should invest more on the area of logistics. Once there's adequate logistics, there will be no much problem in case of any pandemic or outbreak. And lastly, they should invest in provision of adequate functional equipment. As we have mentioned, so many nations during this COVID-19 find it difficult to meet up with the issue of provision of personal protective equipment for their healthcare workers. It will be a very good investment if they invest in equipment. and also ventilators, patient monitors, infrared heat thermometer, consumables, beddings, etc., etc. It will be a very good investment. I think if the government can do that, then there will be adequate universal health coverage in that country. Thank you.
Thank you, Deborah. Yeah, oftentimes they talk about, when they talk about investing, it's investing in the infrastructure, but there's a lot more for them to be investing in. You can invest in infrastructure and invest in the greening of the infrastructure, or, you know, Sue, I see you really want to come in on this one. Go ahead.
Right. I've got a really boring answer to this, which is that we have to argue for governments to change their accounting methods, because they think of that spending a lot of money on a bridge or a road is a really good investment because it has gains in the future. But when they spend on healthcare workers, not necessarily a hospital, but if we're talking about on the actual healthcare workers, they don't count that as an investment. And therefore it's just seen as a cost. And as a result of that, they make very bad decisions. They bias their spending towards these big projects, these big physical projects, rather than towards spending on day-to-day healthcare workers. And the pandemic is a wonderful example of this, because if you look at what's happened in Asian countries that had some preparation for pandemics, that they've managed to get up track and trace systems, they've managed to have the PPE that people need. It's a small cost to have spent on those things, but the amount that even if you only measured it in the national currency, let alone in people's lives, the small cost that it would have been to have had that preparation ahead of time, when everybody, all healthcare professionals knew that there was a danger of a pandemic coming sometime or other. It just shows that one needs an investment framework for thinking about care, education, healthcare, and so on, just like you do for thinking about roads and bridges.
Thank you so much, Sue. Great words to go to the final comments from folks. But before we get there, I just want to read a couple of the comments that have come in. Tasheen says, thanks for the information. I think that one of the 9 important problems children will face is the decline in education due to the distancing and the impact of educational methods due to the pandemic. That is definitely something that we're going to have to figure out. There needs to be that balance, the balance that children need, that social interaction, and they need that, obviously, the education, but they also need to be safe. And for those who keep talking about, you know, children don't get this, well, children do. They do get it, and worse off, they can pass it on to the folks that they're closest to at home, and it could be, you know, elderly family members as well. So there's a balance that we need to figure out before we can, you know, just talk freely about kids going back to school and going back to what the reality used to be, which is not where we want to go, and what is happening currently. So I want to say that we are winding down. Time is going. And I want to hear from all of you just one more time to share some final thoughts or comments as we bring this webinar to a close. So I'm going to start with Monica.
Sí. Bueno, despedirnos de este gran grupo que en realidad ha sido muy fructífera toda esta ponencia de toda usted de conocer las distintas.
It's been very interesting to have this exchange and to listen to these presentations. And it's been very enriching. We've been able to learn more about the situation in other countries. And I would like to thank you for offering us this space to meet and to discuss. thank you for allowing me as a representative of women of Chile to be able to participate, to be there with you, because we also have our needs, but we are interested to see how things are evolving in other countries. We want to make sure that we can work safely. We also need the vaccine, of course, but at the same time, we need some space where children can be educated. We need people to work. All these spaces are very important for people. And as people, as men, women, children, we want to be able afterwards to go back to another life, a life that will be different. And we need to make sure that we will be able to live safely in the future. That's the most important thing. Thank you very much. And I hope that everything is going to be very well for all of you. Thank you.
Thank you so much, Monica. Deborah, final thoughts?
Yeah, my conclusion is that today being the Global Day of Invest in Care is a clarion call to our leaders globally on the importance of investing in healthcare. The COVID-19 pandemic has exposed the decay in our healthcare delivery globally. The government that invests in care is a wise nation, and investing in care will equally lead to a healthier nation. Thank you.
Thank you, Deborah. Editha?
First of all, I would like to thank each and every one of you. Also the attendees for today, our staff, you know, who work together to put this together. I know it's a different time to each other, but we made it happen for today. I thank you all, you know, for doing that. I would like to continue to think about investing home care and childcare in California and a long-term care, you know, for everyone. That's my important, you know, priorities. Thank you so much.
Thanks, Editha. Sue?
Well, first of all, I've really enjoyed this, and I've learned an enormous amount from all the different participants. So thank you very much from this. I have remained fairly optimistic through this because although I can see that the pandemic is causing huge problems for women, it's also, it seems to me, it's a real opportunity. It's a real opportunity to make a case that we might have wanted to make a long time ago, but now have the means for doing it, because people have come to realize that health and our well-being is really fundamental, that it's much easier to make a case that simply the things that are measured in the economy are not what everybody wants. If they throw up their balanced budgets, for example, because of a pandemic, there's something wrong in what they planned before. If they make health override the economy in a crisis situation, it means that they should not have let it do so at other times too. And we need to keep making that case. We need to keep making the case that care really matters, and we do need to invest in care now.
Thank you, Sue. I just want to leave you with a couple of comments. So for those who have not seen the document that was produced by the ITUC, I encourage you to read that. I also encourage you to take a look at the one or two pager that they created for this particular day that talks about what the world will need to do in order to take action for a caring economy, because it's not just about healthcare. It's about mental health services, it's about childcare, it's about early childhood education and education overall. It's about caring for our elderly community members. It is about social care, caring for people with disabilities, all of those things. And so we really need to take a look at what the care economy actually looks like and where we need to push our government. I want to share, just before we close, the fact that Canada, the labor unions in Canada is pushing for a care economy commission. We had originally asked for a task force, but now we're asking for a commission. And we've asked that that commission look at a couple of things. create a broad and inclusive labor market strategy to achieve high quality, equitable care jobs. It's something that we all can do. Examine paid and unpaid care work and develop a roadmap to meet the increasing demands for care, because we know that the majority of jobs that are coming in the future are care jobs, as well as reduce and redistribute women's unpaid care work by improving access to public care services for children, the elderly, and people living with disabilities. Those things that we all can do right now, pushing our government. We can also push our government to ratify Convention 189 and Convention 190. I think that is extremely important. And so I think that is a perfect note to end on. Please, please, please continue to lobby your governments. The care economy is the economy of the future. It is the economy that we need to work if we're going to make this society, this world work in the future. So thank you all. Thank you, special thanks to all the panelists, thanks to the interpreters, thanks to those who are in the background, huge thanks to the ITUC Equality Department, and of course, thanks to all of you who tuned in. Thank you all very much. Have a great rest of your day. And let's remember that the caring economy is the economy that we need right now.
Thank you, everybody.